Hello, everyone, and welcome to When Docs Talk. How's everyone doing today?
Hello, hello.
Wonderful.
Great.
So I want to welcome all of our viewers who are joining us for When Docs Talk. For those who are here for the first time, let's tell you a little bit about ourselves. When Docs Talk is a collaborative that formed to discuss issues that were on your minds, our friends' minds, our families' minds, our patients' minds, and ultimately our viewers' minds. But as physicians who just happen to be women and happen to be women of color, we're really hoping to provide a perspective that's not often seen. So no subject is off limits. Healthcare issues, current event issues, social issues, we put it all on the table. I wanted to introduce ourselves to you as well. I am Dr. Adidiyam Ipe. I am based here in Atlanta, was born and raised in Miami, Florida. Parents are both from Nigeria. I am a proud wife and mother, and I am board certified in emergency medicine and also in internal medicine. And I'm really excited to talk to you all today.
Hi, so I am Dr. Sonia Pinson. I am originally from Georgia Peach, originally from Peachtree City, Georgia. And not retired, but a Navy vet, did 9 years. And after all of that, decided to come back and based out of Atlanta, back home. So I'm glad to be here and glad to, that all of you all are joining us for this wonderful conversation.
Hi, I am Dr. Yolanda Harrison Lloyd. I am a board certified family medicine physician working in an urgent care setting. My roots go deep. They go from Arkansas all the way to New Orleans. My initial practice was in rural Arkansas in Osceola, booming metropolis, I know. I'm a happy urgent care doctor here in Atlanta, Georgia, with my wonderful husband and son, who hopefully you guys won't hear in the background. Glad to be here with you lovely ladies and with everyone watching.
And so, Tanya, I think you're still on mute.
Good evening, everybody. There we go. I am Dr. Tani Jackson. I am a travel emergency medicine physician, Jamaican by birth, a very big foodie, and travel geek. I'm hoping that you guys will enjoy our show this afternoon and happy to see everyone.
Well, that's our crew. For those of you who are joining us for the first time, please go ahead and like, share, and subscribe. We are on YouTube, Facebook, and Instagram. So if you are on Facebook, go ahead and like us and go ahead and also follow our page, When Docs Talk, and share, please. And then, of course, if you're joining us from YouTube Live, go ahead and subscribe and follow us on Instagram. Again, we thank you for watching When Docs Talk. So, as you know, this show is about the COVID-19 vaccine. And those of you who have been with us along the ride since we started last May know that we've talked a lot about coronavirus. And so now there's this vaccine out there. And the way that we wanted to do this show is we wanted to stratify it into facts and fallout. So what do we mean by that? Today, we'll be talking a lot about the facts, the information about the vaccine that you may be wondering. Some of you may know, some of you may want to share. We as physicians and also our experts that are joining us have a lot that we want to impart to you. The fallout will be next week. Next week on February 5th, Friday, same time, same place, we're going to talk about the controversies surrounding the virus. And you know, there are many. We'll talk about long COVID and how people who have survived COVID are still experiencing some symptoms from it. And of course, we'll talk about bullying about the vaccine in both directions. We'll talk about underrepresented communities, Black communities, Latino communities, all of the communities that may not be as excited to take the vaccine because of reasons that we'll talk about in that episode. So today's the facts, next week's the fallouts. Definitely join us. I wanted to just throw up a few stats about COVID-19. So as of today, there are roughly 101 million cases worldwide and over 2.2 million deaths. This is from a virus that came to light, at least to us, pretty much in the beginning of last year. And now here in the United States, there are over 25 million cases and over 430,000 deaths. I also just wanted to impart that coronavirus, we always hear about the death statistics, the mortality surrounding it, but we want people to understand that there's also a lot of suffering that happens while you have coronavirus and after. There are lingering effects, and some of those linger far beyond when you would expect the disease to be over. We always like to throw out a plug for masks. I want to remind our viewers that masks have been demonstrated to help stop the spread. There's new information about how double masking might be even more beneficial. We can talk about that a little bit more in the broadcast. Now, as many of you also know, the coronavirus vaccine first rolled out this past December. And right now, over 10 million people have had the first dose of the vaccine. And over 1.6 million people have actually been vaccinated with both doses. So that said, I wanted to bring up a little bit of information about our poll. Now, some of you know that we had a survey that we sent out because we know how we feel about the vaccine and the virus. We wanted to know how you all, as our viewers, felt about it. And we wanted to know whether or not people are suffering from coronavirus fatigue. Now, what I mean by that is not the fatigue that comes when you get for coronavirus and it literally knocks you on your back, but I feel like people are tired of talking about it and kind of tired of hearing about it. What do you all think?
Well, I
Most definitely.
Yes, and I have to admit I'm tired of it. It gets to be exhausting. I know for us in our work environment, from the standpoint, the amount that we have to do to prepare to see a patient with COVID. So I know for me, even unfortunately, I feel like I have to be aware, like, wait a minute, Sonia, step back. You still have to be vigilant about what you're doing because it's been very tiring. It's been a year.
It's been a year, and unfortunately, even though we as a society are tired of coronavirus is not tired with us, okay? They're not tired of infecting. The coronaviruses are not tired of infecting us. Our hospitals are clear proof of that. So let's launch into our survey results, because a lot of you want to know how your fellow viewers were thinking in terms of the questions that they were asked. Just a few notes on the survey. This was a survey of approximately 600 people. So about 600 of you participated. We're still getting in answers now, but we've closed the survey. And essentially, it was a multiracial group. Every ethnicity that I can imagine was represented, with a heavy predominance, about 50% whites, 33% Black. Any age from 18 to 75 was represented on the survey, with the heaviest predominance being in the age group of the 20s to, say, the 40s. And about 50% of our surveyed were in healthcare in some way, shape, or form. So even if they weren't healthcare providers, they work in a healthcare setting and consider themselves frontline workers. So that was interesting to also note. So let's talk about some of the survey results. Yolanda?
Are you afraid of catching COVID-19? And it seems like it's overwhelmingly yes. 507 people out of the people who responded said yes. 73 said no, and 16 said other.
Okay. So even though we are all COVID or coronavirus 19 out, we're still scared of it. I mean, it's still something that is affecting and frightening a lot of people with good reason.
So what scares you more, COVID-19 or the COVID-19 vaccine? So actually, wow, the majority of people at 89 or almost 90% or 532 people said that, yeah, they were scared more of COVID-19. And only 10% or 60 said that they were concerned or scared about the vaccine. So actually, I'm feel a little bit optimistic about that. I know when the vaccine came out, and even some of the comments, from the standpoint of, when I put out the surveys, people just had concern about the vaccine. So that's actually very promising that people are saying, hey, listen, you know what? I am more concerned about getting this. And maybe, yes, they're going to go out and get the vaccine.
Absolutely.
I think so too. People have been seeing the ramifications. Like they now probably know someone who's had it.
Yeah.
Yep. Someone who's had it, maybe someone who's died from it. Initially it's one thing. When you think about it as a risk benefit analysis, like what I'm more scared of, what's going to give me more risk, more benefits. I think just what you said, Tani, because it's been almost a year, people have had time to really weigh those risks when it comes to the virus. So Tani, can you talk to us a little bit about the top 5 fears that our respondents listed?
So the big 5 are, I'm worried about long-term side effects. I feel this vaccine was developed too quickly, and I'll touch on that more later. I'm worried it will make me feel sick. I'm worried about an allergic reaction, and I don't understand the science behind the vaccine.
Okay. So there were a lot of different things listed as choices, and people were allowed to select more than one, but those seem to be the biggest concerns of our respondents that you listed. However, we gave you all an opportunity to put in your own feedback if it wasn't listed. And some of the things that were listed under the other answers as to what fears or concerns there are about COVID-19 vaccine are listed here on the slide. So somebody was scared of demons. And I really mean that was there. Another person said it killed Hank Aaron. Another person said that there were not enough Black people in the test group. Several people listed concerns about being pregnant and or breastfeeding and whether they knew it was safe or not. And then, of course, there were also questions about not having long-lasting protection from the vaccine. Some people were worried that there wasn't going to be enough of the vaccine. So it wasn't just fears about the vaccine itself, but am I going to be able to get it? Will there be enough? Is it going to roll out to me? Will it run out? So those were concerns that some of our respondents had as well. But in terms of the concerns, there's a lot of misinformation, right? There's a lot of myths, if you will, about the vaccine. And so I wanted us to be somewhat of the myth busters, as I call us today. Let's talk about it. Let's talk about some of the things that we've heard that we know are not quite accurate and see if we can shed a little bit of light on the vaccine in terms of the myths. Tani, you want to go first? Word.
Here. So the first myth was that the vaccine was developed too quickly. And I must admit that I was a little bit concerned when this first came out because I was like, oh, it's only been a year. How could they have developed a vaccine in a year? That seems kind of hasty. And I did some research and I want to share some of that with you. The average time to make a vaccine is usually 10 to 15 years. So you're kind of right in the sense that a year would seem pretty quick. But when you dig deeper, you realize that there's a lot of information that needs to be processed into that. The fastest vaccine that's ever been made was mumps, and that took 4 years to develop. But if you really dig, you'll realize that the science that has been used to develop the vaccines that we're using, which is the messenger RNA, that was not developed in a year. That was developed in decades ago. We've had that information decades ago. I actually read earlier today too that in Wuhan, China, when they discovered that coronavirus was causing this problem, they sequenced the genome within 10 days. And so what you had was a fusion of 2 worlds of science. So you had information that we've known about mRNA and the production of vaccines for decades, combined with a recently sequenced genome for coronavirus. And I'm not trying to go nerd alert on you, but the combination of those 2 things that was able to generate a vaccine in such a short space of time. Also, I want you to remember as well that because this was a pandemic, a lot of people and energies and large groups came together to create this vaccine. So a lot of the rules where people were kind of secretive and hush-hush about their science and trying to be the first one to land on the moon, that was disbarred. Everybody kind of came together and they were like, we have to do everything to fix this because this is a global problem. So a lot of factors came into play, both from a monetary standpoint and a regulatory board standpoint and a science standpoint, to make this vaccine a actual applicable thing within a year.
That's a wonderful explanation. It's true. There's a lot of things because this was an emergency that we were able to do, but it doesn't mean that safety steps were skipped.
Right.
I think that's what you're alluding to.
Yes,
Awesome.
absolutely not. The safety steps and so many regulatory boards, and it's definitely, we did not skip any of those steps.
Awesome. All right. What other myths are we busting today?
I'll go next. The vaccine is a tracking tool.
Oh,
So I saw my vaccine come out. It was very much so a liquid. I didn't see any little squirrely bugs in there, but I took the time to look, what is the world's smallest tracking device? Like absolute. It is a 2.5 gram GPS nanochip. Now, does anybody remember how much a paperclip weighs?
not at all. Tell us.
A plain, uncolored, uncoated paperclip should weigh around 5 grams.
Okay.
So you mean to tell me that something about half the size of a paperclip went through a needle that's what, a 25 gauge needle, very, very tiny, into your arm? No, ma'am. No, ma'am, press him. So if you want to know what a tracking device looks like,
There we
your
go.
cellular device,
Mhm.
which you willingly carry, vaccine is not in any shape, form, or fashion a tracking device.
Mhm.
All right. Now, another thing I think about whenever I think about that tracking device argument, and it's a way to control us as a people. I certainly understand. A lot of as the years have progressed, there's a lot of intrusions on our privacy. Social media has been wonderful, and smartphones have been wonderful, but they also have introduced us to a lot of privacy violations in many cases. So I can understand why people would have those concerns. But another thing I think about is, would the people who want to track us, why would they also be getting the vaccine? You have to think about it. When you think other people are trying to do something to you, do they want to do it to themselves too? I think that's probably why we see so many people in leadership positions or otherwise who are actually out there showing you them getting their vaccine too. Thank you for busting that. Thank you for reminding us the weight of a paperclip. Sonia, what are you busting today in terms of myths?
So for my myth is that after the vaccine, we don't have to wear our mask anymore. We don't have to socially distance anymore. We're good. We're free. I can go do everything I want to do. And that is only a myth. From the standpoint, we're still going to need to do precautions, because the vaccine, even though Pfizer states that it's 95% effective, and I think Moderna is close at 94 to 95%, it's not 100%. And then also, when you get the vaccine, they still don't know from the standpoint if you could actually carry the virus to someone else. You might not get the illness and get sick, but you could still potentially give it to someone else. So that's still something we still have yet to know. So really the key from the standpoint, we know, and once again, I think you alluded to that earlier, Didion, from the standpoint, we know that masks are effective from the standpoint of helping to stop the spread. Also, we know from the standpoint, everybody still needs to stand at least 6 feet apart, avoiding crowds. I know everybody wants to go back to the club. Don't recommend that. Maybe hold off on the party, and even with the vaccine, avoiding the poor ventilated spaces, but also making sure that you wash your hands often also.
Yes, absolutely. That's a good point. Once again, going back to the whole notion of COVID fatigue, of course, people want to stop wearing masks.
Yeah.
There's a lot of people who are fiercely and strongly against masks. They think it's a violation of their rights and their privacy. And the truth of the matter is, nobody likes wearing masks. I hate wearing a mask, but I'm the most mask wearing person you might meet. I will wear it because it's safe. And so I understand why people think, oh, it's party time after you get that shot, but not yet. Our hope is that eventually it will become so. Eventually it will be the case that when enough people are vaccinated and this disease does not have the opportunity to replicate and spread, we will be maskless. We will be in the club like Sonia was talking about, all that good stuff.
Or at least on a vacation. I'm ready to get on a plane and go somewhere.
Yes.
Not right now.
So I actually wanted to also talk about a myth, and the myth that I often hear is people often say that the vaccine will give you coronavirus or it's going to make you sick. So I'm going to actually break that into two parts. Let's talk about giving you coronavirus. So I understand why they would maybe think that, because there are some vaccines historically that have been what we call live attenuated, meaning a weakened form of the virus that you're trying to vaccinate against is given in order to induce immunity. So it just gives you a little bit of immunity, right? It makes your immune system work, but it's not strong enough to actually cause you to get the virus. So that is virus vaccines in the past. And maybe that's where people are coming from when they assume that they'll get coronavirus from the vaccine or that the vaccine has coronavirus. But I just want to be very clear. The coronavirus vaccines, all of them that have been rolled out or are in the working, do not contain the coronavirus. So you cannot get coronavirus from the vaccines because it's not in the vaccine. What is in the vaccine is something, a protein, a synthetic or something that looks like a protein that the coronavirus has. So it tricks your body into believing that the coronavirus is there, okay? But it's not there. So you cannot get coronavirus from the vaccine. It is not in the vaccine. Now, make you sick. I've heard this about coronavirus vaccine. I've heard about flu vaccine. Oh, the flu vaccine made me sick. It gave me the flu. Let's talk specifically about the coronavirus vaccine. So at this point, quite a few people have had the shot, and they've been able to tell their experiences with it. Like several vaccines, sometimes you do feel a little bit achy. Some people feel some pain at the site. There are some things that you might feel after, but there's no one that we've heard that has become plainly sick with it. And the few instances where we've had cause for concern in the studies have been very, very minute, very, very small amounts. By and large, people are not getting sick. Even those who are uncomfortable have reported they take a Tylenol, they take an ibuprofen, and they feel better in many instances. So one thing I can tell you that will make you sick and very sick, and for the long term, is COVID. Okay, so once again, coronavirus is not in the vaccine, and the vaccine by and large is not making people sick. So let's just lay that to rest. I want to move on and go back to a little bit more in terms of our statistics, because we had our viewers fill it out. So let them know what the people said. So in terms of our viewership and the people who filled out the survey, we asked, have you taken the coronavirus vaccine? And by and large, it was an overwhelming yes. Overwhelming no. Let me not say even overwhelming. By and large, most people had not taken it, and quite a few people who had taken it, I'm going to go to the next slide. Quite a few people who had taken it, we asked them to exclude themselves from the next question and say not applicable. And we asked those who had not, if you haven't taken the vaccine, do you plan to take it? So remember that we had a lot of people who took our survey who are in healthcare, which probably explains why they were almost neck and neck with who has taken it already, because it's not available to all the people who are not in healthcare. So then when we excluded those people who have already taken it, you can see that the people who are left, when we asked them, do you plan to take it, said yes. Okay, roughly 37% of the entire group, and certainly a higher majority of the people who haven't taken it, if you look at the graph, plan to take it. So that's good news. It just tells me that, when it was available, plenty of people took it. Those who haven't taken it are very interested in taking it. And so I wanted our viewers to know who among us have had that shot, okay? Because we talk about, getting it and so forth, but sometimes you got to put your money where your mouth is. So who got that shot among WDT? Well, yeah, you see that you see somebody's actually getting it. I see you, Londa, there. There's me with my thumbs up. So we have had the shot, and I wanted to talk a little bit about our experiences, because people who are still contemplating it wonder what it is after you've had the shot, how you feel, what made us want to get the shot. So I'm not going to start. I'm going to let Tani start, even though she didn't have her picture up there. And I teased her. I said, if you don't take a selfie, it might not work as well. That's a joke. Of course, it'll work. But
I took the shot. I took the shot for a number of different reasons. I'm done with my series. My first shot, I was joking around saying maybe they put water in my shot because I didn't feel anything. The second dose, however, I did have fever. I had fever for 2 days straight and headache. But when I tell you, I was dancing in my house saying, thank the Lord, my hypothalamus is now activated and I am mounting an immune response. I was super excited. I was at home dancing despite having my fever. So it's not like I expected this. And I was excited to have a fever because to me that meant something. And I think one of the bigger reasons I got the vaccine was because I'm of Jamaican heritage and my family, I wanted to set an example for them because the interaction between medicine and people of color has a very difficult relationship, a strained relationship. And so my family is not first in line to get the vaccine. And I think if I didn't set an example and make it okay, they probably wouldn't take it. So I think that was a big reason for me. And also I want to go places and
got places to be.
I want this whole era to be done, this pandemic era to be done. And I want to feel safe when I go to work. I think that's super important for me. I feel very uncomfortable when I'm at work because of all the extra precautions and just knowing it's in here with me. So just an extra layer of comfort. Not means I'm going to back off on the PPE, but it means that I have a different way of moving when I interact with patients.
Fair enough. What about you, Yolanda?
I have certainly gotten both doses of my vaccine. My last one was on the 8th of January, and hallelujah for that. As far as my process afterwards, I actually documented it on my Instagram and my Facebook. About 6 hours afterwards, I got like some chills with the first shot, a little bit of pain. After the second shot, for a solid day, I felt like somebody was trying to take my pelvis apart. But ibuprofen, Tylenol, and it went away. And my reasons were, I recall very vividly when COVID first started, I was breastfeeding my son. So you're at work, you got your PPE on, and then you're this close to a super, super vulnerable life. And I'm like, I would do anything I can to keep this baby or my husband or my mother-in-law or anybody I come in contact from getting this. Plus, I'm from a military family. We're all like, come on, put it in here. Let's do this. So I need to be an example for everybody who loves me and who sees me.
I hear you. I hear you. So we have a question from our viewer about herd immunity, and it's a very important concept which we'd like to discuss. We're going to table that for our question and answer session. We'll talk a little bit about what that is and how this vaccine will help with herd immunity. But I wanted to hear from Sonia, Dr. Penson, because I'm sure some of our guests might have noticed that you didn't have a picture up there of you getting the vaccine. And it wasn't like Tani, who just didn't take a picture. It's because you didn't take the vaccine. You want to tell us a little bit about that?
So I contracted COVID-19, and so I had it December 3rd. So I have to, we see the patients that are really sick. We still don't quite know why certain people get sicker than others. We kind of have some risk factors, why people get it, but we really don't know. And so that first night that I started having symptoms, that was probably one of the most anxious, scary times I've ever had in my life, because I didn't know how I was going to end up. Was I going to end up like one of the people that were in the hospital or potentially intubated? You see so many young people, we think about just old people dying from it, but no, we see the young people dying from it. So I didn't sleep that whole first night. But thankfully, I didn't have a lot of respiratory symptoms. I was able to breathe. My oxygen remained fine. I just felt the worst I've ever felt in my life. I had headache, muscle aches. I didn't want to get up. I could get up maybe to use the bathroom and, eat something and go back to sleep. It took about 2 weeks for me to stop feeling confused, not able to concentrate. I couldn't even watch TV or read a book while I was sick because I just couldn't focus. I couldn't think. I would lose my thoughts, words. So finally, after about 2 weeks, that did clear up. It took me, I'm still get tired. So, this is about 6 weeks out, still get tired, but not having the muscle aches, anything like that. Once again, thankful I wasn't hospitalized. But after having that experience, I know that I'm going to get the vaccine because I can never have that again. And I definitely I wish people could feel like I felt. I don't wish that on anybody. But then again, I just don't want anybody to feel like that. And also just to have that fear of not knowing how this was going to end up for me. So I have to wait 90 days before I can get the vaccine. So after that, I'm going to get it.
Sonia, I'm so sorry to hear about what happened. I remember when you told me, and I remember speaking to you at the time, and I'm so happy that you recovered from it. It's scary because you don't know which category you're going to be in. Like you said, you don't know if it's going to be something that you survive relatively easily. And I say relatively because no one has a fun time with COVID, or whether you're going to be in that camp that doesn't make it. And we're so happy that you made it. And you mentioned something at the very end. You talked about how you're planning to get the vaccine. A lot of guests have asked about when you could get the vaccine after you've had COVID. So first of all, you can get the vaccine and should get the vaccine, even if you've been exposed or had COVID-19 before, I should say. It seems like most of the experts at this point are saying that it is probably advisable to wait some time after. And the figure that we've heard and read in the literature has been about 90 days. So 90 days after you have had coronavirus, you might start to lose your immunity, and it's probably worthwhile to go ahead and get the virus at that point. For me, a lot of people around me at work and everything got the vaccine. I did not. I had it now. I have been vaccinated. I had my first dose only. So some of you have had both doses. I only had one. And the reason why is because I recognized the same concerns that a lot of you out there have, a lot of people have. I had them myself, and I'm in medicine. I'm somebody who is not quite the first to try any new medication or anything, and certainly not the last. I'm somebody who likes to read. You talk about nerd stuff. I will like to read. I want to know. I want to read the studies. I want to see who was tested, when they were tested, how they were tested, what was the methodology. And I felt like I didn't have the opportunity to do that. So I said, it's time for me to take that time and do that. So I read and I thought about it, and I watched what other people had said about it. And I really came to the conclusion that it was worthwhile. Another thing that went through my head that I've heard a lot of you say, in fact, in the top 5 reasons you all gave us, you said you're worried about the long-term effects of the vaccine. And I too was like, I wish it was like the flu vaccine or any of the many vaccines that I trust and get every year and give to my children, even, where I can look back at the literature and say, oh yeah, they studied this for years and years. I wish it was like that. However, I really had to do kind of a risk benefit analysis, and I waited. I said, okay, I'm worried about the long-term effects of vaccines. However, I know that most vaccines, the very negative and significant side effects that happen earlier on. It's usually not years down the line in most vaccines historically. That's one. 2, I started to hear more stories of people who have had COVID, and I saw the long-term effects of COVID. And that's not even debatable. It's not a hypothetical like it is with the vaccine. What are the long-term effects of the vaccine? Possibly blah, blah, blah. This is like things I'm seeing in people who have had COVID almost a year later. And I definitely know and knew that I didn't want that. And so when I weighed those risks and benefits, and I read more about the vaccine and how it was developed and the science behind it, and read about the safety protocols, and saw my friends and colleagues getting it, I said, yeah, I'll do it. And then I talked to my mom, and my sister talked to my mom, and my cousin talked to my mom, and she was not going to get it. You talk about having Jamaican parentage. My Nigerian mom, who was a nurse herself and very educated, she had her doubts, but she said, you know what? Since you guys keep bothering me, I'll take it. And so I said, if my mom is taking it, which I think she should because she is older and she's in a population where we think really needs protection, I need to get on board. So I read, I studied, I prayed about it. Mommy got on board and I took it, and you saw me getting my shot. So I want to be able to let you all answer questions because I see all the questions coming in. And as much as we want to talk to you about our experiences, we want to know what you want to know, and we want to bring on our experts. But before we bring on our guest experts, we just have a quick word from one of our sponsors. They want to tell you about their product, Judy Care Skin Products. They are all natural, organic, and I'd like to let you know a little bit about it.
Have you consistently dealt with skin reaction? Is your skin tone uneven? Do you have a strong desire to consistently look radiant without the use of excessive chemicals in the name of cream? Well, luck just found you. WDT Care skin care products might just be the long-awaited breakthrough for your skin, as they have developed organic-based skincare products just for you, so you keep that elegant look without damaging your skin cells. Product like cream, serums, toners, mask, moisturizer and cleanser. You know the most interesting part. It cost absolutely nothing to check out the website, www.judyyoucare.com.
All right. So we are back. And actually, we have our guests. I wanted to introduce them one by one. But before we do that, I wanted to actually give some of our viewers a little bit of information about how the vaccine works. So I've heard the question in person and I've heard it in the comments. And one of our guests who's not here with us today, but was able to have a pre-recorded session that we'd like to share, is going to tell us at When Docs Talk a little bit about how the coronavirus vaccine works, and let you know the science behind it in a way that I think you'll understand and will be very entertaining. So Dr. Kimberly Manning is joining us. She also goes as Grady Doc, and she's going to tell us how the coronavirus vaccine works, and hopefully that'll shed some light on the mechanism.
I'm here to talk to you a little bit about the science behind the COVID vaccine. And I'm going to do my best to do this in a way that is not overly confusing, but also that, respects all of you, because I think a lot of folks are saying, well, dang, why won't anybody break down the science of it? What am I actually getting? And I think that is a really reasonable thing to want to know. And I'm a nerd, so I love any opportunity to teach. Okay, so we'll first start with a couple, two basic things that I want to start with. The first basic thing is understanding the difference between DNA and RNA. So your DNA is like your blueprint. Think of it like if you build in a house and you need a blueprint to say, all right, this is the floor plan, this is what it's going to be like, this is what's going to be on the first floor, how many bathrooms, where the hallway is going to be. That big sheet that you lay out that says what it all is, that is what DNA does, okay? Next is RNA, or as it relates to the COVID vaccine, mRNA or messenger RNA. And what mRNA does is think of it like a contractor that says, all right, so we got the blueprint. Now let's give you some instructions about what to do. I want you to put this here. I want you to put this here. I want you to build this way. You know what? Yeah, let's put some granite right here. Let's do this. A contractor kind of makes sure that they give the clear instruction so that what is on the blueprint gets executed. Does that make sense? All right. So why this is important is because the COVID vaccine is not a DNA vaccine. You're not getting something that's going to interrupt your blueprint, change who you are, encode into you, track you wherever you're going, none of that. What it is just like an mRNA vaccine. So think of it like a little tiny baby contractor coming into your cells and telling certain cells what to do. Okay. That might sound scary to you because you're like, I don't want nothing coming into my body and into my cells, telling my cells what to do. That makes sense. So I'm going to break this down a little bit further. So these really smart people, when COVID came out, they said, all right, shoot, this SARS-CoV-2 virus, let's map this whole thing out and let's like in reverse figure out what the blueprint is of this virus. And that's what they did, right? So they did all of that, worked that thing all the way out. And when they looked at the whole virus, they saw that the virus has a bunch of proteins, like 29 different proteins. But one of the proteins on the COVID virus is super gangster, and the most gangster one is this one called the spike protein, and that's the one that like deboes up into people's cells and gets them sick. So these scientists, people like Kizzy Corbett and all of these other folks, they said, you know what? What if we create a vaccine based upon the instructions on how to just build that little spike protein? And what if your body built some of that spike protein, and not the whole virus, but just that spike protein? And what if your body saw those spike proteins getting built and said, yo, this ain't supposed to be here, and developed an immune response? Similar to what happens when you actually get COVID, but instead just aimed at that spike protein, right? Okay, so let's back it up a little bit. So what they did was that they developed an mRNA vaccine, which only is a little like information just to code for that little spike protein. Now, the other piece you have to know, because I'm gonna just nerd all the way out, is that you can't just roll up on somebody's body and think that if you have a little piece of messenger RNA, you can just hand it to their cell and their cell's gonna be like, yo, thank you. You have to kind of wrap it up in something. So it's kind of wrapped up in something called like this lipid layer that allows it to get into your cell. Okay, so 1, it's not a DNA vaccine. 2, it's a mRNA vaccine, but it's only coding for that little gangster spike, that one spike, not the whole virus. So you're not getting the whole virus. 3, it's wrapped up in this little lipid like jacket so they can get inside of your cell. Okay, so now we're at the point where this little piece of mRNA that's in your vaccine has gotten inside of your cell. So remember, the mRNA is like the contractor. So this little contractor has now gotten inside of your cell when you got your vaccine, and it says, all right, what we getting ready to do is we about to build this spike, okay? And, you know, you got all the materials in your body already to make the spike protein. So your body is like, let's do this thing. And your body, your cell is like, oh, this is what we doing? So we start making spikes, spike, 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 spike. You making these spikes. So, you know, no big deal so far until your cell goes like, wait a minute, this ain't something that like is supposed to be in your body. This is not something from us. This is coming from somewhere else. Somebody has invaded us. This is like a foreign material. You know what? Hey, immune system. So it calls out to the immune system, and these cells called macrophages roll up, and they just swallow up the cells with the spikes in them whole. But check this out. This is what's so dope about our immune system. Before the macrophages swallow it up whole, something happens first. And what happens first is that your body says, you know what? We got these T cells and we got these B cells, and we remember you. Kind of like somebody who did you dirty, but then they come back smiling, acting like you forgot. That's what your immune system does. Okay, so what your B cells do is it makes antibodies. And antibodies are gangster, because what they do is they get made and then they sit back in the cut and wait for something to pop off, okay? They don't do anything until something pops off. The T cells just kind of be on the lookout, almost like, you know, the little lookout dude, like, oh, let me see what's going on. Okay, so you get your dose of vaccine. Your body, makes these antibodies. The T cells now know what the spikes look like, so they on the lookout. And the other really dope thing about mRNA is it doesn't even stick around. It's like the UPS man. It comes, drops off the instructions with the little contractor, the contractor says what he has to say, and then disappears. So after you get the mRNA, it's gone. It ain't even like you have anything still living in your body, right? All right, so then COVID, you go, let's say you go to, see your friend's mama, and she come up to you and she's like, oh, I'm fine. And she start laughing in your face, and her mask is like under her nose, and she got COVID. And the COVID then creeps into your body. And then here comes COVID rolling up on your body, right? With them gangster spikes, right? But when the gangster spikes get into your cell, remember, we got some memory. So the T cells are like, oh, hell no, that ain't not who I think it is. And then the B cells are just gangster. They just be like, break yourself, fool. And they roll up and just. Now, the more antibodies you have, right? The more antibodies you have to roll up, the better, which is why we give you one dose and then we give you another dose. So you can have all them antibodies ready and waiting, So I think like when you get the first dose, it'll be like 50 something percent. But by the time you get that second dose, you're like in the 90 something percent range. So that's pretty much how it works. So if you have ever been somewhere where you saw somebody and you thought they were cool, and then they showed up and they did something crazy to you, and then a whole bunch of time went by, and then they rolled up on you again, and you had forgot, but your friend was like, that's that person that said so-and-so. Your friend is like a helper T cell. They're like, yo, And then if you got a bunch of really crazy friends, they can just be like antibodies and just bum rush without saying nothing, no conversation. So that's the science behind what's happening. It is not a DNA vaccine. It is an mRNA vaccine coding for this little gangster spike that gets wrapped up inside of this little lipid blanket, gets in your cell, steps in, says, yo, make some spikes, then disappears. Your body starts making the spikes, and then the body realizes it's foreign, scoops it all up, but not before the immune system says, we remember that. Okay, we remember that. And creates the little army of antibodies so that when something happens next time or pops off, it ain't going down like that. So you need to get vaccinated. Don't say you don't understand anymore.
I love it. I love it. Thank you, Dr. Kimberly Manning. That is how the vaccine works. You want all your cells on the lookout, T cells, B cells, we want all of it. Let's bring on some of our other guests. I want to introduce, with no further ado, first, Dr. Xanthia Wiley. Dr. Xanthia Wiley is an Emory infectious disease specialist. She is the Director of Antimicrobial Stewardship at Emory Midtown Hospital and the co-chair of the Emory COVID Treatment Guidance Committee. And we are so delighted to have her here. Welcome, Dr. Wiley.
Thank you so much for having me, ladies. It's been a fun go so far.
Awesome. I'm going to bring on our next guest as well. Dr. Eric Flano is the Chief of Pulmonary and Critical Care Medicine at Morehouse School of Medicine and frontline in the MICU, the Medical Intensive Care Unit at Grady Hospital. He works directly with the critically ill COVID patients and is a member of the COVID response leadership team for Grady Hospital. He's actively involved in community outreach for education and the vaccine rollout. And in July 2020, Atlanta Magazine honored Dr. Flano as a top doctor and as a frontline hero, featuring him on their cover. Please help us welcome him as an honored guest. Welcome, Dr. Flano.
Thank you for having me. And I noticed I'm surrounded by women, which is not a bad thing.
Well, I am happy that you are here, and I'm happy that you don't mind being the male in the group. And let's bring on our last guest expert. We have Dr. Megan Kirksey. Dr. Megan Kirksey received her PhD from the Rockefeller University of Microbiology and Immunology and her medical degree from Weill Medical College of Cornell University. She joined Hospital for Special Surgery after completing specialty training in anesthesiology at Weill Medical College of Cornell and her fellowship training in critical care medicine at Columbia Medical Center. She has been actively involved in the care of critical COVID patients and education related to COVID complications, treatments, and vaccines. We are so happy to have her. Please welcome Dr. Megan Kirksey. Hey, Megan.
Hi, welcome.
Welcome, guys.
So we have you all on here with your wealth of expertise and also all that you've seen. We've shared our experiences kind of along the way as emergency practitioners since we started When Docs Talk. I want to start off by asking you all, have you gotten the vaccine?
Got the vaccine, yes.
Got the vaccine, thank goodness, yes.
Okay, so you all had the vaccine. And if you just want to say a one-liner about why you decided to get it.
So I'm happy to start. So I got the vaccine for my family, for my community, for my patients. you know, literally since March 13th, when I saw my very first COVID patient, first patient was Black, second patient was Black, third patient was Black. And this has gone, you know, on and on, just seeing how it's disproportionately affected our community and my family. Both of my grandparents 2 weeks ago were hospitalized, same room with COVID. I have an aunt who had COVID. So it's really affecting us so significantly. So I wanted to do whatever I could do to, you know, not have it.
Thank you for that. And I'm sorry to hear about your grandparents.
Thank you.
What about you, Dr. Kirksey?
So I'm in New York City, and we got hit early and hard, brutal, with no warning. So I spent a good part of the past year worrying about getting sick, dying from COVID, spreading it to my friends or family. So the fact that we've been able to get a vaccine available so quickly has been a gift. I did have reservations. My body responds in weird ways to various things. But one of my biggest concerns was how my body would respond to COVID. And I've seen what it's done to some of my colleagues. I've seen what it's done to my patients. And I got sick with something bad that wasn't COVID right before the vaccine became available, and got tested 5 times and didn't know if I could be with my kids, didn't know who was safe to be around, when I could go back to work. And so I got the first round as soon as it was available.
Great. Thank you for your story. And what about you, Dr. Flitto?
Yeah, I got the vaccine. We've been immersed in this for the past, a year now. And the patients started rolling in pretty heavy for us right around the end of March. And we're exposed to it all the time. And it's one of those things where it's not a matter of whether or not you get it, it's when you're going to get it. And I figured if I could do something to sort of decrease the likelihood of me getting it, I was going to take it. I have a family that I'm around all the time. We were in and out of other coworkers. I'm more likely to be a spreader. So it's a safe thing for me, safe thing for the family. And I think it's a good thing to get the message out to other people.
Absolutely. So we're just opening this up to our viewers. We have a question from Karen Banks, and she wants to know, since there's been such a push to get kids back in school, why aren't teachers in this first wave of vaccination? And if whoever decides to take that might want to say a little bit about the tier system that we have for vaccinations, because some of our viewers might want to know more about that. Who wants to take it?
Oh, I'm happy to take that question. So the most important thing was making sure that the people who are most likely to be exposed to COVID receive the vaccine first. So that is our frontline healthcare workers. And people who would have a higher likelihood of having a bad outcome. Therefore, our older patients are patients who were in long-term care facilities, those who are over 65 years of age, and other frontline workers such as police officers, etc. So the teachers are considered to be part of our frontline workers, and the goal is for them to be 1B. So they're coming. They're definitely not at the end of the line. And part of that also is that our children, fortunately, are less likely to have these significant complications from COVID. So a wonderful question. Teachers are next in line, and we all know just how important it is for them to get the vaccine so that they can take care of kids.
I will say that the federal government has given some discretion to states in terms of determining the details of the tiers. And in New York State, teachers have been included in this second wave of vaccinations. In-person teachers.
In-person teachers, right. Okay. We have another question that was on the screen prior and that I promised we would get back to. Can someone speak a little bit about herd immunity? First of all, what it is for our viewers who are not familiar with it, and whether it's a real concept.
Okay, I can take that. So herd immunity, it's a real concept. What's behind it is to say that you have enough people in a community that have developed immunity to this, let's say COVID in general, have developed enough immunity to slow down the spread of it. And hopefully, if you have enough people and the spread slows down enough, it'll start to fizzle out. Depending on the studies that you read, it's somewhere between having 65 to 70% of people with immunity before you start to see that it's significantly, take a significant effect. The concern with letting a natural herd immunity occur with this virus was the rate of infection, because it was spreading so fast with such a severe disease. It was overloading our hospital and healthcare system. And the other thing was the death rate was high. And if you have to reach that number of people, but you have a death rate in the 1 to 2%, you're talking about 3 million to 7 million people dying before you reach herd immunity, which is not acceptable. The most effective and fastest and safest way to achieve herd immunity is with vaccination, right? Because then you don't have the death rate, you don't have the hospitalization rate, and you can reach that if we get a good program out and get people immunized.
Absolutely. I heard somebody say this, I think it was Dr. Fauci, and, basically, it's important that we stop the virus from replicating, and the vaccine is actually one of the best ways that we have to do that.
One of the concerns that a lot of people have is the new variants that are circulating. And one of the determinants of how quickly you can achieve herd immunity is how easily the virus is spreading. So now that we have viruses in the population, that variants that seem to be spreading more easily, that bumps up the percentage of the population that has to have immunity before you develop herd immunity and protection on a population level. So the fact that there are variants circulating actually means that we need to get people vaccinated more quickly.
Absolutely. It cannot mutate if it doesn't replicate. And I wanted to just throw this up because a lot of people have asked me questions about that. And backstage, if you don't mind just removing that comment so that our viewers can see this slide, because a lot of people have been asking me personally about these variants. I heard there's a variant from the UK and a variant from South Africa, a variant from Brazil. Now, this slide is a little bit technical. It was provided by Eric Topol of the Scripps Research Institute. But the things I wanted to point out to our viewers from this slide is that right now there are 3 main variants of the coronavirus as we know it that are being studied. And these mutations of them, one of them we know in terms of transmissibility or how contagious it is, we know is more contagious than the others. And that's the UK one, also known as the B1171. There's about a 40% in increased contagion or contagiousness, if you will. In terms of whether they're more deadly, that's still being studied in all of them. So, the concern was raised about the UK one, but not really resolved. They don't think that it's necessarily more deadly, but it's something they need to study. And the other 2, the South African one, the Brazilian one, they haven't established whether it's more contagious or more lethal. One thing that they have been also doing is they've been looking at the vaccines that we have now and how they impact these mutated strains, because that's another question that I'm sure many of you have received. Like, why are we taking this vaccine if there's all these new mutations? It won't even work for it. So I just wanted to also provide another bit of information for our viewers on that. And that just tells you about the different vaccines and their differences and their efficacy in general against the SARS-2 COVID virus that we are familiar with, and their effectiveness or efficacy against the mutations. So if you look on the list here, let's just look at the third column, overall efficacy. You can see that Pfizer and Moderna are about equal, which is another question I received, about equal in terms of how effective they are. And the Johnson & Johnson, that's the 1-dose vaccine that has received a lot of attention lately, that will be rolled out soon from what we understand. It's about 66% efficacy. And Novavax and AstraZeneca, you can see at 89 and 62% efficacy, respectively. Now, if you look at the South African strain, you could see there's a lot of question marks there because they're really not quite sure with a lot of the vaccines how effective they are against this strain. They have studied the UK mutation, and it seems that Pfizer and Moderna, which are the two vaccines that are available now, are pretty effective against that strain. And the Johnson & Johnson one as well, Novavax and AstraZeneca, at least the same efficacy as it is with the traditional non-mutated form. But I bring this up just to, one, answer some questions about the differences between the vaccines, but also to talk about those mutations, because I really would hate for people to feel like the vaccines are in vain or there's no point in getting them because of these mutations. Because as you can see, there is some effectiveness, some efficacy of the vaccines against these new strains. And even with the old strain, as Eric mentioned, and as we've already kind of stated, if you decrease the spread of this virus, you're going to leave less room for more mutations. So it's really important that we stop the spread, mask, hand washing, social distancing, and of course, this new tool in the fight, the vaccine. Now, there was a question from, I believe it was Basi Udosen, had a question. If we could throw that back up there, I'd love one of our experts to take that too. If I vaguely recall, while we're looking for it, our production is looking for it, I think it had something to do with the effect of how do we know that the same vaccine that the doctors and nurses are receiving, there we go, is the same one that they will receive as well. Who would like to take that one?
I'm happy to take that one. So we know this because there are currently only two that are available for all of us. And those are our two messenger RNA vaccines, the Pfizer and the Moderna. And they are the same vaccines, made in the same factories. The same ones that you all are receiving are the ones that we're receiving.
Thank you. Another great question from Morgan Harvey, who is pregnant. Congratulations. And she wants to know, is it safe for her to take the vaccine?
So I can talk about that. That becomes a little bit tricky, but you have to, first, let me preface this by saying always have a discussion with your physician, right? And they can help you determine what the risk and benefits are and weigh those and determine. So in the studies, they didn't really report and study pregnant women. So there's some women that became pregnant. But what we do know in comparing risk and benefits is that if you are pregnant, and you get COVID, you are 5 times more likely to end up in the intensive care unit than someone who's not pregnant that gets COVID. You're more likely to have a preterm birth. Okay. And it's a lot of those factors that you need to have a discussion with your physician, see, because we know if they have 95% efficacy with that, so that these vaccines are very successful, very, very efficacious in preventing severe disease. And you have those risk factors just merely by being pregnant. If you're matched with age for a non-pregnant person and other risk factors, then it's worth a discussion with your doctor to see if it's going to be safe for you to get the vaccine. And if there is a way and they feel it's safe and they recommend it, I would go along with that.
Great.
Can I just point out, ACOG does recommend that this vaccine not be withheld from any pregnant person just because they're pregnant.
Yolanda, can you tell our viewers what ACOG stands for?
ACOG is the College of Obstetricians and Gynecologists.
Wonderful. So the experts on pregnancy, essentially, those who deliver the babies and care for pregnant women, you're saying recommend the vaccine?
That is correct.
A lot of people have expressed concerns about breastfeeding as well, and they have similar recommendations. And the thinking there is that, while the actual vaccine components shouldn't have any effect on the baby at all, babies get the antibodies from the mothers. So developing an antibody response from the vaccine and giving those antibodies to your baby will help protect both of you.
That's a great point. And thank you for bringing that up, because they do ask. And just to kind of round out that topic, we talked about pregnancy, breastfeeding. Can you say a little bit about concerns about future fertility with the vaccine?
Absolutely. So with respects to for fertility, there is no evidence, there's no science that says that taking the vaccine will affect your fertility moving forward. And the same OBGYN institution, the American College of Obstetricians and Gynecologists, they say the same thing, that if you plan pregnancy, that you still should receive the vaccine.
Okay, thank you. So I see here, Bob Kirksey wants to know, should I be worried about the vaccine interacting with other medications?
Fantastic question. So no, and I get this question a lot. Will it affect my, interact with my blood pressure medications, my diabetes medications, my inhalers, etc.? No interactions at all.
Okay, that's important to know. Thank you. What about how long it lasts? If you can recall on our survey, that was one of our top concerns that our viewers expressed about how long it's even going to last. Does anyone want to say a word about that?
So initially, it was some of the initial studies said that immunity was somewhere between 90 days to 6 months. Recently, there was some data suggesting that it may actually be a little bit longer. I think Pfizer was showing some data, maybe up to about a year. I think a lot of that will vary from person to person, depending on their underlying immune systems and health status from that standpoint. But we are somewhere in that 6 months to a year time frame.
Okay, great.
You're speaking about the virus, I believe, right?
What they're asking about is the vaccine, how long will it last to protect you against the virus?
So the actual data that we have, those in patients who've been infected by the virus, and I think these 6 to 9 month numbers are coming from patients who are either losing detectable antibody levels, or we are starting to see people who were infected early on who are getting reinfected. We just haven't had the vaccines either in development or in the general population long enough to have an answer about how long it lasts. But the thinking is that the immune response is more robust, and the expectation is that it will be more enduring than natural infection.
Okay. That's good to know. And so I guess that kind of, it in part answers the question that Michelle McFadder has is, will we have to be vaccinated again? Is it going to be kind of like the flu shot when we have to take it every year? What are the speculations on that?
So these are all wonderful questions. And I think sometimes we have to say, we don't know. So we don't know if we're going to require another vaccine. And with a lot of these variants that are coming out, we may even have to have a booster to the Pfizer and the Moderna. So, it's difficult for doctors, for us to say, we don't know. What we do is, do our best to use the science that we have. And what we know is that COVID is disproportionately affecting people who look like all of us on this panel, and that we're dying disproportionately from it. And the one thing, or one of the few things that we can do is, get the vaccine to get these numbers down. So hopefully none of us will have to worry about next season, next go round. What can we do right now? So the answer is, honestly, we don't know.
One of the discussions that's happening right now about boosters that are already in development is around how we can target future rounds of the vaccine against some of these variants that are developing. So it may be not even an issue of how enduring the response is, but having to deal with new variants that are circulating in the population, similar to getting a flu vaccine each year that's specific to the flu of the year. The other thing I wanted to say about the data suggesting that there's decreased protection with the South African variant. And I think Novavax released the most data about this. And it's about 56% protection. And what they're talking about there are two levels of protection from a vaccine. One is protection from getting the virus, and one of the protection is protection from getting severely ill from the virus. Mm-hmm. Right. And so those numbers that they're reporting are detected infections. So only 50% protection with the South African variant, but none of those patients in any of the populations with any of the variants were hospitalized. Okay. So the protection from severe disease seems to be holding up.
Can you comment even a little bit more? Because I think that's a great point that people, I think, might need to know about when they get the vaccine. Definitely worry about it spreading or getting it, but also knowing that it could actually help if you do get it, not necessarily getting as sick.
I think you just said it.
No,
No, but for real, no, honestly, Sonia, that's exactly a very important point. And I think it extends even beyond coronavirus, even to like the flu and so forth. We have to remember that these vaccines are not magic bullets to make sure you never get anything. Luckily, with this one, the coronavirus vaccine, it's quite good. And it, in many instances, it will protect you from getting it. However, even if you do get it, what we're seeing is that it will be a very weakened form. We're not seeing people get sick. We're not like sick where they have to be on a ventilator. We're not expecting that you would die from the coronavirus if you've been vaccinated. So you have to really put that into your decision as you're deciding whether this is for you. Because the truth of the matter is even if you do catch coronavirus, it's unlikely that you'll die from coronavirus.
Absolutely.
Do you want to take chances from dying from the virus, or do you want to take your chances with the vaccine? That's kind of the question we're asking.
Absolutely. And I wanted to bring up something else. And Dr. Kirksey, I'm glad you brought that up, because one of my biggest fears is that everyone's going to look at some of the newer vaccines that aren't 94 or 95%, effective and say, oh, I'll wait and I only want the Pfizer and the Moderna. But just like Dr. Pinson and Dr. Kirksey were saying is, what's also important is how sick will you get? And what another really, big point about the Johnson & Johnson is it's one shot. So a lot of this where people are getting their first shot and they are having difficulty scheduling that second one. And, some of the vaccines have to be frozen. With this Johnson & Johnson, it's one shot and it can be in a regular refrigerator. So what I plan to tell my patients is, if you want the Moderna and Pfizer, fantastic. If it's available, go for it. However, if that Johnson & Johnson is available and that's what you have, take it, because 60 to 70% is still doggone good. So our flu vaccines that people line up and get every year, the best that we get with the flu vaccine sometimes is 30 to 60% effectiveness. And we sign up, we go get it. We're excited to get it. So let's have that same motivation with our COVID vaccines.
Absolutely. Absolutely.
And can I make another point too? And it's something important to keep in mind that these vaccines were released under emergency use authorization, but the outcomes, the adverse reactions are still being tracked in real time. So we're still learning more about the efficacy, about the side effect profile, and the length of immunity as we go along in real time. And we got to keep that in mind. When you get your card, they're going to put on that card the date you got it and the lot number that you got your dose from. And that'll be tracked. And on the back of your card, there's some websites and reporting systems. If you have adverse side effects, if you have some concerns, you can go to those sites and get information about that. And it's very useful to both utilize that and pay attention to that card and how it's being used. And one more thing that I've been telling my patients, I said, you get the vaccine, it doesn't give you this magical force field that's going to keep the virus from getting on you or spreading around. It's not like a COVID repellent. You still have to keep up with the mask, the social distancing, and the washing your hands. But if we get to this level of immunity, herd immunity, then we should all see that all start to go away. They don't need it as much, and we can start to get back to normal.
Absolutely. I love how you say it's not like a magical force field. You still have to wear masks. As I think, Sonia, you were saying that earlier, you still have to make sure you protect yourself and others from it. Because as I don't know if it was Dr. Yolanda or Dr. Sonia, somebody else mentioned earlier that we're still not exactly certain whether if you're immunized with the vaccine, whether you could spread it. I think there's some suggestion that there may be a possibility. So we have to be very careful with that. I want to switch gears just a little bit. Actually, there's one more great question. I really would like you guys to address it. Noreen Mark wants to know, how effective is it if you were only to get one vaccine out of the two and you're not able to get the second shot? Because that's a question that's come up quite a bit.
I can start that one. And the data is actually interesting on this. From the Pfizer study, I've looked a little more closely, but the protection from the Pfizer vaccine seems to start at about 10 days after the first shot. And that's when you see the two curves diverge between the people who have been vaccinated and those who have not. the question that hasn't been answered is how enduring is the protection from that single shot? It is thought that you're more likely to get the virus, but again, no one, even after the first shot, ended up with severe COVID. So if you are unable to get the second shot for some reason, like if you're one of those very rare people who has a significant reaction, or there's some delay in getting the second shot because of logistics, you should still have some decent protection from the first round. But if you're able to get both, that is the ideal situation, scenario.
Okay, great.
And for people who like numbers, what I like to say is after the first shot, it gets you up to about 50% efficacy. After that second shot, it'll take you all the way up to your 90, 95%.
Mm-hmm.
Okay. What about the question about ingredients? And I think preservatives was something else somebody had asked earlier on in the broadcast. What other things are in the vaccine aside from this mRNA? Can you guys talk a little bit about that? Because people worry, especially with the question of allergies, which was one of the concerns that our viewers expressed in the survey.
So as Dr. Manning mentioned on her that wonderful video, so there's the messenger RNA, and there's the lipid kind of carrier. And also inside is something called PEG, P-E-G, which is polyethylene glycol. And that is an ingredient that is in some osmotic laxatives like Miralax. So in most of, and one other is like another little preservative that you have to have in kind of to help stabilize it. So with respects to allergies, the only thing that if you have an allergy to where you should not get the COVID vaccine is if you have a severe allergy to that polyethylene glycol or the polysulfates, which the vast majority of people do not have. So if you have a severe bee allergy, medication allergy, etc., you should still be able to get the COVID vaccine. Just like we've all said, speak with your primary provider. They may refer you to an allergist, but it is safe.
I wanted to say specifically, there's no thiomuracil in this vaccine. None, zero. There's none.
There are also no fetal cells involved in the development of this vaccine. I know that's a concern for some people.
Absolutely. Absolutely. It's a big concern. In fact, I'm glad you answered that because that's one of the things I have on my list here is what about the fetal cells? And you've just answered it. There are no fetal cells in this vaccine.
Or used in the development of this vaccine.
Or used in the development. Okay. Excellent. Thank you for clarifying that. I want to transition before we end, because I know we're over time, although there's so much good information that you've imparted and so many more questions. I want our viewers to know that we will answer some of your questions at our site, and also next week, Friday, same time, same place, will be another opportunity to ask more questions. So I want to transition to the whole notion of long haulers, or the long COVID as they call it. And somebody had asked a question about that. First of all, can any of you explain to our viewers what you mean by long COVID or long haulers?
Sure, I can take that. So what we found is that even after some of the patients get over the initial COVID syndrome, there's still some side effects that linger in different organ systems. And we're still learning more as we go along, but some of these have lasted for months, some are short-lived, and it's hard to tell who's going to have what and how long it's going to occur.
Sure.
Some of the organ systems affected, the lungs, it's a COVID pneumonia. A lot of times when they get sick, there's a lot of inflammation and injury to the lungs. And they're not so sure if a lot of it is because of ongoing inflammation or if it's a scarring process that occurs, but some of the patients have long-term chronic damage to the lungs. About 20 to 30% have injury to their heart, whether it's irregular heartbeat rhythms or function. And then the biggest thing that we're starting to see more of is the nervous system, the brain and the nerves peripherally. You've heard of a COVID fog. Comes from like different mechanisms. If it's a encephalitis type from the acute infection where you get swelling in the brain and some of that persists, or if it is actually the infection of COVID in the brain. We've had a lot of problems with clotting with this disease, and sometimes it gets small clots, sort of like stroke-like. Some can be large, some can be micro strokes. And then the other thing is like loss of nerve functions. The biggest one you've heard about is taste and taste and smell sensations, which about 10% of the people never get that back. But there's also COVID, and where that's an inflammatory process, the actual infection is still sorting through, it injures the lining of the nerves which conduct. So you see people are starting to get more nerve dysfunction, loss of some sensations, strength, and sometimes like an MS type syndrome.
Wow.
And the last thing that we're really seeing is long haulers is the kidney disease, because a lot of the patients, when they come into the intensive care units, we see the one problem they have is with their lungs and breathing. And the next organ system we see damaged is the kidneys. And about 78% of those patients that come into the ICU end up requiring dialysis. So, and they may survive. And a lot of people get very focused on surviving and the survival rates and whatever else. And you'll hear, 99% of the people survive. But it's, what is that survival like? And when you have those type of percentages of people who are having long-term complications with their heart, with their lungs, with their, with their kidneys, with their nervous system, these are the people that are going to have, chronic disease processes for the rest of their lives.
Absolutely. I'm so glad you mentioned all those things, because I think it's important to know that COVID is just not where you can't breathe and you're coughing a lot. It affects so many different systems, like you mentioned, everywhere from the brain to the hematological system where people are forming clots to the kidney, etc. But I want people to stay tuned next week, February 5th, because we're going to be talking about COVID long haulers, people who have experienced COVID. We're going to hear personal stories, narratives of people who had it, some of them months and months ago, almost a year ago, and are still having symptoms. And it's not the symptoms you think about that require you to go to the hospital all the time. We're talking about things like people who still can't taste and smell. And what's your quality of life like when you can't taste things, you can't smell things? You're the person who makes food for your family, and you actually can't taste what the food tastes like. What's your quality of life like when you're losing hair, or when you're walking across, the room in your place of employment and you have to stop and get a breath and you're 30 years old? You see, there are things that COVID causes that we don't hear about that much. And Dr. Fulano, thanks for talking about some of them, touching on them. But next week, we're going to hear those stories from people's mouths. So make sure you tune in. I want you all to join us Friday, February 5th, 8 p.m., same time, same place. We're going to talk about the fallout. So the controversies in COVID-19 and the vaccine. So we talked about the facts, and we had our experts on, and I thank them so much for being here. But we want to also next week talk about the controversies. And what we mean by that is, what are people saying in terms of the issues with race, the issues with enough vaccine being available to people who are impoverished. We want to talk about that. We also want to talk about bullying concerning the vaccine. Some people feel like they're being pressured, bullied. You're stupid if you don't get the vaccine. You're part of the reason that it's spreading. And other people feel bullied in the opposite direction. Some physicians have had stories where they're bullied by people, told that they're agents of the state or enemies of the people. So we want to talk about that. Before we have our closing words from our host, I just want to say thank you so much to our experts, Dr. Wiley, Dr. Flano, Dr. Kirksey. Thank you for weighing in, and thank you for what you do. Thank you for taking care of these patients. Thank you for educating all of us, and we hope to see you in the future here on our show.
Thank you so much. It's been wonderful.
Thank you, guys.
Thank you.
All right. So from our crew, I just wanted to know if there are any last words you wanted to impart about the vaccine to our viewers before we take off. Tani? We can't hear you, Ann. It's not a side effect,
out in the background, guys. I've been hanging out with the guys in the back, with the people in the background, guys. You don't know how lovely of an audience we have here on the show. I just want to take some time and shout out to the audience today. The questions were very insightful, educated questions, things that I think really helped to create a formative discussion. So I just want to say shout out to our listeners and viewers this evening.
Thank you.
Yes.
Sonia, parting words.
Yeah, no, wow, this was just a great show because I mean, definitely we've all been doing our own research and trying to learn and to know, but I tell you, we were very fortunate to have those experts come and talk for us. So I really thoroughly enjoyed it. And also, yeah, shout out once again to all the people that watched and had those questions. And I'm hoping that they all come back and join us next week because I can't wait to hear about next week because I'm hoping, I don't know, maybe they can do a consult on me.
Wonderful. And what about you, Yolanda? What do you?
Oh my goodness. I've enjoyed trying to watch us and the audience, and it's been a great show just in general. The experts, you guys, the audience, it's just been a great show. I've appreciated this. I want everybody to read, educate yourself, ask questions if you need to, and just continue to take care of yourself, please.
Yeah.
Amen. Amen. You took the words right out of my mouth. Like literally what I wanted to say was educate yourself. We don't want this show to be those doctors are trying to push us to take this vaccine. Yes. I'm not pushing anyone to take anything. I want you to use whatever we have imparted to you tonight. I want you to read and please reputable sources. You can find evidence for anything in this world. You can find evidence on the internet that the world is flat and that the sky is purple, or let me take it further, black. Make sure you're very careful with what you educate yourself with. Make sure that these are people who have studied this, researched, and provide that evidence to you in the form of studies. This is important. Listen to your friends who have taken it. Listen to your friends who are doctors. Let your doctor BFFs, which we're happy to be. Listen to them. Listen to people's experiences. Think about it. Pray about it. Whatever you need to make the decision that's right for you and your family, please do that. And be sure to join us next week. I want to close by just sending a brief tribute to Miss Cicely Tyson, a living legend who we lost just yesterday. She's inspired so many, and we'll miss her. She was 96 years old. And another very important lady to me, my auntie, who passed away. I thank you all once again for being here. It's been really fun. You guys are the best viewers. Thank you for filling out the survey. Join us next week. Yeah. Same time, same place. And once again, to our guest experts, we appreciate you so much. Keep being excellent, excellent, excellent. See you next time.